Picture this. You're sitting quietly at home, maybe reading, maybe relaxing. And suddenly, your body feels different. Not painful, not dramatic, just different. A slight chest pressure. A wave of weakness. A breath that feels heavier than usual. Most people over 65 ignore this moment. But doctors say this is the moment that decides everything. A heart attack doesn't always start with pain. It often starts with a whisper. And if you miss it, the next stage may come too fast. Heart specialists agree, the first 5 minutes after symptoms begin are critical. If you take action now, you protect your heart. If you wait, the damage starts. Your heart doesn't fail suddenly, it weakens minute by minute. Quick action saves lives. Delayed action destroys heart muscle. This video shows you exactly what to do in those crucial minutes. After age 65, the body doesn't send strong warning signals. Arteries stiffen. Nerve sensitivity drops. So instead of dramatic chest pain, most seniors feel unusual tiredness, mild chest pressure, jaw discomfort, back or shoulder heaviness, dizziness. These soft symptoms trick people into thinking it's nothing serious. But at this age, when your body feels off, it's rarely random. The average senior in the US waits 2 hours before calling 911. 2 hours is enough to cause permanent heart damage. In that time, heart tissue begins to die because it isn't getting enough oxygen. Many people hope the discomfort will fade. But hope isn't a treatment. Taking action is. When you call 911, you're not just calling for transportation. You're calling for medical treatment that starts inside the ambulance. Paramedics bring oxygen, heart monitors, clot-stopping medications, and tools that can stabilize you before you even reach the hospital. Calling fast increases your chances of survival dramatically. Don't drive yourself. Don't wait for family. Call immediately. One small action can make a big difference: chewing an aspirin. Chewing helps it work faster by slowing the formation of blood clots. But only take it if your doctor has told you it's safe for emergencies. It's not a cure, but in the right moment, it helps buy precious time. Heart attacks look different as we age. Some people feel pain in their back or shoulders instead of the chest. Some feel pressure in the jaw. Some feel short of breath while sitting still. Some feel only sudden weakness or nausea. The rule is simple. If something feels unusual and doesn't go away quickly, treat it as a warning. In an emergency, paramedics need your medical information fast. Having a simple card with your medications, allergies, doctor's name, and emergency contact can save valuable time. Keep it near your bed, in your wallet, or on the fridge. During a heart attack, every second counts. Most heart attacks in seniors occur between 4 a.m. and 6 a.m. That's when blood pressure rises and the heart begins working harder. Your body may also be dehydrated after sleep, making blood slightly thicker. That's why early morning symptoms should never be ignored. And why your phone should always be near your bed. During early symptoms, calmness becomes medicine. Sit upright. Breathe slowly. Avoid moving around, climbing stairs, or driving. Staying still reduces stress on your heart until help arrives. A calm, steady response can protect your life more than you realize. Many seniors experience sudden fatigue as one of the first signs of a heart attack. You might feel unusually tired after just walking across the room or doing simple chores. It's subtle, but it's a warning. Never ignore extreme tiredness that comes out of nowhere. It could be your heart signaling distress. Not all heart attacks involve intense pain. Seniors often feel mild pressure, squeezing, or tightness in the chest. It may come and go. Even if it's brief, do not dismiss it. Call 911 immediately. Early action can save your life. Heart attack symptoms in seniors can appear in unusual places. Pain or pressure in the jaw, neck, or even upper back can indicate a problem. These subtle signs are often mistaken for dental pain, arthritis, or muscle strain. But in someone over 65, it's safer to assume it's heart-related until proven otherwise. Shortness of breath is a critical warning sign. Even if you have no chest pain, difficulty breathing can signal your heart is struggling. Sit upright, stay calm, and call 911 immediately. Do not try to walk it off or rest quietly in bed. Breaking out in a cold sweat or suddenly feeling clammy can be a subtle heart attack sign. This is your body reacting to stress in the heart. If this happens along with other mild symptoms, treat it as an emergency. Let's summarize the most important points every senior must remember about heart attacks after 65. Heart attacks often start quietly with subtle signs: mild chest pressure, fatigue, jaw or shoulder discomfort, shortness of breath, or nausea. Early recognition is crucial. Don't wait for the pain to intensify. Call 911 immediately, chew aspirin if your doctor has approved it, and keep your emergency information ready. Stay calm, sit upright, and remain still until help arrives. Avoid driving, walking, or attempting chores. By recognizing the signs, acting quickly, and staying prepared, you give yourself the best chance to survive and recover fully. Your heart is sending you a warning. Listen carefully, act fast, and protect your life. Remember, these small actions today can save your life tomorrow. Many seniors unknowingly make critical mistakes during a heart attack that can be life-threatening. Some wait too long, hoping symptoms will disappear. Some try to drive themselves to the hospital, putting both their life and others at risk. Others ignore mild symptoms or attempt household chores, thinking it's nothing serious. And some lie down, which can actually increase strain on the heart. The truth is, every second counts. By avoiding these common errors, acting immediately, calling 911, staying calm, and remaining still, you dramatically increase your chance of survival. Remember, heart attacks after 65 often start subtly, but the right actions taken quickly can make all the difference between a full recovery and permanent heart damage, or worse. When you begin to feel heart attack symptoms, one of the most important things you can do is stay calm. Panic and stress increase your heart rate and blood pressure, which puts extra strain on an already struggling heart. Sit upright in a comfortable position and breathe slowly and deeply. Focus on keeping your body as relaxed as possible. Do not walk around, climb stairs, or attempt any physical activity. Even small movements can increase the workload on your heart. By staying still and composed, you help maintain better blood flow to vital organs and give paramedics the best chance to stabilize you quickly. Calmness is not just comfort, it's a life-saving strategy that can make the difference between a mild heart attack and a fatal one. Did you know that many heart attacks in seniors occur between 4 a.m. and 6 a.m.? This is not a coincidence. During these early hours, your blood pressure naturally rises, and your heart works harder as your body transitions from sleep to wakefulness. At the same time, dehydration from overnight fasting can make your blood slightly thicker, increasing the risk of clots. That's why sudden fatigue, mild chest pressure, or shortness of breath first thing in the morning should never be ignored. For seniors, this means taking simple precautions: keep your phone within reach, have your emergency information ready, and know where your aspirin or medications are, if approved by your doctor. Being prepared during these vulnerable hours can save critical time and significantly improve your chances of surviving a heart attack. Preparation is one of the simplest ways to save your life during a heart attack. Every senior should keep a clear and accessible emergency information card. This card should include all your medications, allergies, your doctor's name and contact information, any chronic health conditions, an emergency contact number. Keep this card in multiple places, next to your bed, in your wallet, or on the fridge. Why is this important? Because during a heart attack, paramedics need this information immediately to provide the best treatment. Even a minute spent searching for details can cost precious time. By preparing in advance, you give yourself the best chance of quick, effective care, and that can make all the difference between life and death. One simple, life-saving step seniors can take during the early moments of a heart attack is chewing an aspirin, but only if your doctor has approved it for emergencies. Chewing the pill allows it to enter your bloodstream faster than swallowing it whole, which can help slow blood clot formation and improve blood flow to the heart. This small action, combined with calling 911 immediately, can buy precious minutes for your heart muscle and give paramedics a better chance to stabilize you. Remember, aspirin is not a cure, it doesn't replace emergency care, but in the critical first minutes, it can make a real difference between a mild heart attack and a life-threatening event. Always keep an aspirin handy if your doctor says it's safe, and know how to use it properly during an emergency. This tiny step can save your life. The moment you notice unusual symptoms, mild chest pressure, fatigue, jaw discomfort, or shortness of breath, every second counts. Many seniors make the critical mistake of waiting to see if it goes away. This delay can be deadly. The first step is simple but vital: call 911 immediately. Paramedics don't just transport you, they provide life-saving treatment on the spot. They bring oxygen, heart monitors, medications to prevent clotting, and rapid assessments that start before you even reach the hospital. Don't try to drive yourself, and don't wait for a family member to decide what to do. Your fast action is the difference between a full recovery and permanent heart damage, or worse. Remember, act immediately, stay calm, and trust the professionals to guide you through the emergency. After age 65, heart attacks often start quietly, with symptoms that are easy to overlook. You might feel a mild pressure in your chest instead of sharp pain. Sometimes it's fatigue that hits suddenly, like you've been running a marathon even when sitting still. Other times, you might notice discomfort in your jaw, neck, or shoulders, or a strange heaviness in your back. Some seniors feel shortness of breath, dizziness, or even nausea, and mistake it for indigestion or a muscle strain. The danger is that these subtle signs are often dismissed, even though your heart is warning you that something is seriously wrong. Here's the rule: any sudden, unusual, or unexplained symptom in your body after 65 should be taken seriously. Don't wait for it to get worse. Your early recognition can give you the best chance of survival. Listen to your body. Trust the warning signs. And act immediately if anything feels off. Heart attacks in seniors rarely start dramatically. Instead, they often begin with subtle symptoms: mild chest pressure, unusual fatigue, shortness of breath, or discomfort in the jaw, neck, or back. Some may feel cold sweats, lightheadedness, or nausea. These signs are easy to dismiss, but at age 65 and above, even mild changes in your body should never be ignored. Recognizing these early warnings is the first step in protecting your heart. Many seniors make a dangerous mistake, waiting for symptoms to get worse. Even mild or confusing signs can indicate a serious problem. The most important step you can take is immediate action. Call 911 as soon as anything feels off. Paramedics provide oxygen, monitoring, and medications that can save your life before you even reach the hospital. Never try to drive yourself or rely on someone else's judgment. Speed is critical. If your doctor has approved it, chewing one aspirin can slow blood clotting and improve blood flow. Chewing works faster than swallowing and can buy crucial time. Alongside this, always keep an emergency info card handy with your medications, allergies, doctor's contact, health conditions, emergency contact. This small preparation allows paramedics to start treatment immediately, saving precious minutes and potentially your life. During early symptoms, fear and movement can worsen the situation. Sit upright, breathe slowly, and stay calm. Avoid walking, climbing stairs, or any physical exertion. Remember, the heart works hardest when stressed. By staying still and composed, you give your heart the best chance until help arrives. Early recognition, quick action, and calm behavior, these are the 3 life-saving steps every senior should remember. Some seniors feel dizzy or lightheaded during a heart attack. This can happen even without chest pain. It's your heart struggling to pump enough blood. Sit down immediately, stay still, and call for help. Heart attacks in seniors often mimic digestive issues. Sudden nausea, stomach discomfort, or a feeling of indigestion can be signs. Do not ignore it or self-medicate. Call emergency services immediately. The time between first symptoms and treatment is critical. The longer the delay, the higher the risk of permanent damage or death. Even mild or confusing symptoms should be treated as urgent. Living alone after 65? Preparation saves lives. Keep your phone charged and close to your bed. Have medications and a list of your health conditions ready. Small actions today make emergency response faster tomorrow. In the moments of early symptoms, fear can worsen the situation. Staying calm reduces stress on the heart and improves oxygen flow. Sit upright, breathe slowly, and wait for help. A composed response may be the difference between life and death.